Well, good evening, everyone. This is Dr. Ellithorpe. We're here today with Tustin Longevity Center. This is in Southern California. We're a functional integrative clinic. We've been here about 25 years, serving the public all the time and through the pandemic, and never closed our doors and never had any impact. Rather, we impacted everyone else by keeping everyone healthy. And we're so thankful to the Lord for that guidance that He gave us during that time. So we do this question and answer every Tuesday, 6 o'clock to 7 o'clock. During this time, we're not trying to treat you over the YouTube, but rather just keep it educational. I'll answer a question about a type of medical issue, and I'll give a generalized response about what I think about when someone has symptoms that they're discussing or questioning me about, and how I would begin to approach a repair system, a natural way your body will need to respond to whatever the general issue is. So we have four healthcare providers here, and you can get a hold of us calling 714-544-1521. You can get on our weekly email list for these YouTube question and answers. It's called Ask the Doctor Anything. And that is at our website, tlcdoctorsplural.com, tlcdoctorsplural.com. And there you can get our newsletter, and we'll notify you every week when these are coming up. And there'll be a link in the email. You can type in your limited characters into the link for your question, and then they'll get to me. I get them right after work, so I don't have much time at all to prepare. But I'll do my best. And if I don't know something, I'll write it down. I'll try and look it up, maybe have the answer next week. But with that, the other thing you can do is, if you're on YouTube, you can type into the question and answer here. We go live questions first, then we go to the YouTube answers. Also, we have the typing out of the transcript that you can come back to later if you go on our website, tlcdoctors.com, and go to the blog, and you can see what we talked about. You can kind of screen through it, what might interest you and how we responded to it. So if this is helpful and interesting to you, please please subscribe. And that sure helps us out, and we can help other people try and do more preventative things to stay healthier and live longer and help our fellow man more. All right, so let's begin. We have some live questions already coming in. And the first one is from Pilar. Pilar says, "Thank you for being here and what you do." Well, thank you, Pilar. I enjoy doing this. And if it's a benefit, again, hopefully you'll like and subscribe. Okay, so our question is, curious to know what your thoughts are about taking vaginal estrogen for genitourinary syndrome of menopause. So as a woman gets older and her hormone production declines, the benefit of the hormones, which is like general contractors helping to repair tissue, the thickness of the tissues is lost. And everything thins out and dries out vaginally, and it becomes very problematic for a woman's vaginal area. Itching, dryness, chafing, the membrane is disrupted, invasion of bacteria, viral areas, very much pain and discomfort with intimacy. It's much easier to get urinary tract infections as the barriers break down. So hormones are a great benefit to this area. And yes, I'm in favor of even intravaginal treatments. I normally use estriol, estriol, estriol. A woman makes three kinds of estrogen. Think of the word Toyota for cars. So in the world of cars, you have Toyota. And then you can have a Lexus, one of their fancy ones. Then you can have a Corolla and maybe some other kinds. So when we say the word estrogen, we're talking about an umbrella reference to female hormones. It's not identifying any one in particular. Of the three, the one that really is the most beneficial vaginally is estriol, or what we call E3. E3. What we make as women all the time from our teenage years on with menstruation is estradiol. Estradiol is E2. And then estrone is E1, and that's a dimer between estradiol. In other words, saying estradiol can exist in two actual forms, estrone and estradiol. So I typically give estriol vaginally as a cream insert in some base Eucerin cream. I usually mix it with a little bit of testosterone to enhance the muscle contraction of the urethra to help prevent urinary incontinence. I'll put in 3 milligrams of estriol with 1 milligram of testosterone per gram of vaginal cream, and you can do that every night for a week, and then that should already help greatly, so that you can taper off and only use the cream twice a week, or at most maybe 3 times a week. And that usually helps women tremendously with all the complaints of pain, dryness, lack of control of urinary continence, those kind of things. So yes, I'm in favor, Pilar, of using estradiol, estrogen products. Now, if you take it in another way, for instance, I take my estradiol as a cream and I put it to my face. I never use it vaginally. But my hormone levels of estradiol, when I check them, are high enough that it allows me to have a little menstrual cycle every month, a light menstrual cycle. So if I have enough estradiol to have a monthly little cycle, and then of course I take progesterone cyclically, then that means there's enough estradiol, and when I check my levels, it's high enough that all my body is benefiting, including the vaginal area. So I don't need additional material down there because I'm already having enough estradiol in my whole system. So usually women who get on hormone replacement therapy will not need extra vaginal estradiol cream. They'll have enough anyway, so that all their hormone needs and tissue needs for that repair and function will be satisfied from their natural hormone replacement therapy program, whatever it may be. Occasionally, there are some women I do both of them with. So hopefully that helps you, Pilar. Thank you for your question. And then Tiziana, hi Tiziana, how are you? And happy birthday to your husband. It's a wonderful thing. I saw that you were celebrating his birthday. So you're asking, what is the ideal ratio between HDL and triglycerides? And is this more important than having a high LDL? Thank you, as always. The answer is a really a perfect ratio would be a 1-to-1 ratio. So if your HDL, high density lipoproteins, are, let's say, 70, your triglycerides from eating starch, carbohydrates, and fruits is 70, then you have a 1-to-1 ratio. Some doctors are more liberal than me, and they'll say a 1.5, so that you could have the triglycerides, let's say, be 100 and let's see, 10, maybe 105, and then you divide 70 HDL into the 105 triglycerides, and it'll go about 1.5 times. And so they'll accept that as well. So they allow the triglycerides to be a little bit higher than the exercise HDL. I am happier if they're equal or very close to one another. Now, if the triglycerides are lower than the HDL, then I'm thrilled. I'm very, very happy. So the answer to that, the perfect ratio, is really about a 1-to-1 ratio. Some good doctors have allowed the triglyceride to be a little higher, so that it's a 1.5. So if whatever the triglycerides are, you divide the HDL into it. If it goes 1.5 times or less, they accept that. I prefer a 1.1, and I certainly like it when it's lower than a 1, because that means you're really well protected. And therefore, that answers your second question. What is more important, than having a high LDL? And the answer is yes. They have put out what I call misinformation that low density lipoprotein LDL is a bad cholesterol. And I say God does not produce any bad, useless molecules. He wouldn't have made LDL if it doesn't have a wonderful function in the health and maintenance of a human body. And so, one of the big values of LDL is to help your immune system. Your LDL cholesterol can help take up endotoxins from your gut, which is full of all this trillions of bacteria and viruses and so forth. And when they make toxins, the LDL is like a sink, a cleanup crew for some of that junk that leaks through the wall. And it's a tremendous immune support for your human body. So I don't worry about the LDL cholesterol, especially if I know my patient is exercising, is eating mostly protein, and is not eating late, and their triglycerides are low or equal to the HDL. Their blood sugar is around 85 or less. Their insulin is around 4 or less, and their fasting blood sugar is about 85 or less. And their hemoglobin A1C is about 5.3 or less. So if you're doing all those things, it would be very hard to see that you would get any of these chronic diseases. So hopefully that answers your question. And then Tiziana adds, what if your triglycerides are lower? No, yeah, that'd be even better. It is even better if your triglycerides are lower than your HDL. So that's perfection. Okay. So that's very good. And I would think last time I saw your lab, you were in that camp. So very good for you. All righty. Let's go to some of our emails. Let's see. Akira. Akira says, can chronically damaged prostate cells caused by a bacterial infection be repaired with NTF factor lipid powder supplement after the infection has cleared? The answer is yes. And he goes on to say, how can chronically infected damaged prostate cell be repaired? Well, I was in the original work and support helping promote NT factor in supplementation. It is phospholipids. So remember, every time I have this picture out, it serves all my needs. This is a damaged cell membrane right here, the double sandwich. This is a double layer of phospholipids. These are the phospholipids, the little blobs are the proteins. And when that's injured, you have to repair it to this level here, to a nice repaired cell membrane. And you do that by eating egg yolks and meat and fish and chicken with the skin on it, bacon, sausage, eggs, things like that, so that there's enough of the material to fill this hole up with. And that's the cell membrane. So long ago, I've been practicing almost half a century. So long ago, when I saw them and my father saw them tearing apart, eating meat and eggs and butter, my father, who worked in Armor Food Research and fatty acid special research, was involved in hydrogenating the fats to make TV dinners so that the double bonds would not combine with oxygen and become rancid and have a bad taste and odor from freezer burn. That's called freezer burn. And so back in the 1950s, he would tell my mother, there's no vegetable oils in our house. There's no, Crisco, none of that. We had lard and butter, and that was it. And so these are the elements that make up that cell membrane. So when you're dealing with a human population that has been eating so very little meat and chicken with the skin on it, not deep fried, I'm talking about roasted chicken, egg yolks, things like this, when they're not eating that much because the corrupt medical mafia has been taking away that knowledge, people are eating their junk food and getting ill. We had to come up with a nutrient, a supplement that would help amplify their phospholipid consumption, as especially to those who were so afraid of eating eggs or so afraid of eating meat. So we created this phospholipid powders that you can mix into a drink. And remember, they are fats. So I usually tell my patients to take the phospholipid powder and mix it into warm water, like 4 ounces for a little warm shot, like you're going to make a baby bottle drink, warm water, 90 degrees of that. And then that amplifies the material to help repair the cell membranes of the prostate. So, yeah, so the more you eat meat and eggs and chicken with the skin on it and fish, these things are going to help your prostate. The other thing is you have to make sure the infection is resolved. You don't want to have ongoing damage breaking down those cell membranes. The other thing I recommend a lot is doing EDTA chelation therapy with vitamin C and the B vitamins and minerals in it, because that kind of improves the tiny web-like capillaries to help the prostate get better circulation, which creates better blood flow for these repair molecules to get there. So I think that's very important also. So hopefully that helps you, Akira. Um, Christine says, "Hi, Dr. Ellithorpe. I have 2 questions. First one is, I have had a sore throat for 2 weeks now. I don't feel sick, but I do have postnasal drip and a very red throat on all sides. Could this be allergies? Yes, it could be. Or virus? Yes, it could be. Or both? Yes, it could be. Should I come and see you? If you feel that you're not getting better, I would. My second question is, have you heard of Microgen DX? Microgen is spelled MICROGENDX. What do you think of this type of testing? Um, I am not going to throw it out with the bathwater, baby with the bathwater, but I'm going to tell you these polymerase chain reaction PCR testing can find anything depending on how many cycles of amplification they're looking for in any human fluid, tissue, or extract. So I don't think they're reliable. So I don't trust the PCR testing, and they can claim anyone has COVID when they're just looking at potentially dead fragments of coronavirus. And there's many kinds of coronavirus and many types of coronavirus illnesses. So I don't think that if I find some fragments of it on a PCR test, or antigen antibody test for it, that I'm convinced that anybody has the alleged COVID-19. That goes for this thing called Microgen DX. See, instead of saying, let's find bacteria, viruses, fungi, parasite fragment DNA, let's instead say, why don't we build up your immune system, or what we would call the terrain? Why don't we build up your cell membranes, okay? Repair these cell membranes so that viruses, bacteria, fungi, and parasites cannot get as easy access into your body. So they don't talk about that because they can't make money off of healthy people. So they're going to amplify, boy, we can figure out what exotic little thing you may have. And they'll always use terms like likely or may or probably, as opposed to anything definitive, because they don't culture anything on this. They're doing PCR testing. So I think it's filled with opportunity for deceitful sales and misguided management. I would rather see a doctor who's trying to help me very aggressively have a good, healthy body, or what we call the terrain, build up your cell membranes and things like that. So hopefully you can understand that answer, Christine, and why I don't think a lot of Microgen DX. I still think, ever since they did the CRISPR study and Kerry Mullins developed the polymerase chain reaction, of course, he's dead. And of course, he died right before they declared the pandemic. because he's the one who said you never use my invention of the polymerase chain reaction for diagnosis. And so that would go against this thing right here. But of course, don't tell anybody the truth. Just keep everything to yourself and just rip them off with frightening things and keep them in fear, coming to you like you're the god of health and the god of medicine. Okay, let's see. Heather asks, is chelation safe with a titanium implant in my mouth? The answer is absolutely yes. It's absolutely safe. Yes, you may use it. We're getting in some new questions here. Let's see. Alexander says a 4.5 size cyst on the kidney. So that's roughly about 2 inches. What are the possible outcomes, and does it need further testing or just watch? In general, the older you get, the more you get, like my skin is starting to get wiggly here and hang. I'm starting to get wiggly skin under my arms. I'm drooping, I'm sagging, my vocal cords and my whole box is sliding forward as I'm aging and I'm losing my muscles. So the skin turgor, the elastin collagen, everything's starting to sag and age, despite all the exercise, healthy eating, and things I do. And I say that because you have to understand your kidneys are hanging in your body too, and they're jiggled and sagging, and there's micro trauma on it. And with that micro trauma, let's say with the micro trauma, you get a little tear, and then you suddenly get a little cyst, in that kidney, okay? And then it'll tear more and more. So your kidneys are getting withered, crepey skin too, and they're getting cysts. In general, if it's isolated cysts, it's less concerning. If it's many, many, many cysts, what they call polycystic kidneys, then it's a concern to be followed more closely with a kidney specialist called a nephrologist. An isolated kidney cyst, though, doesn't usually bring me much concern. But again, I don't know who you are, Alexa Alexander, and I do not know your background, your age, or anything like that. So please have your doctor, you follow it with a ultrasound, and you can get a second opinion and see a nephrologist specialist as a one-time visit and see if what I'm saying is correct about isolated cysts like that. And there's really no treatment, and they just follow it. Do your kidney creatinine, look at your urine, make sure your kidney functions are normal. And this is not uncommon. In the 44 years I've been practicing, I would say kidney cysts are found incidentally and liver cysts are found incidentally and less often in the spleen, but we see this all the time. But do follow up on that. He goes on to say no symptoms. Yeah, so typically you don't get symptoms, but it usually develops midlife with some ultrasound done for another reason, and it's an incidental finding. Let's see. Cynthia says, what do you think about peptide injections? Cynthia, I am a kind of like a tire meets the road doctor. I'm a first care, used to be emergency, prior military. I'm a general practitioner for 44 years. And I think we get too excited and fancy dancy over much to do about nothing, looking for one shot solutions when a healthy lifestyle and healthy practices are what we need to do consistently. And when we talk about peptide injections, we're talking about things that are involved in, like human growth factors, stimulating more muscle and strength and tissue repair. Sometimes they put them into the joints to help cartilage repair with these platelet-rich particles that they inject. These are growth factor peptides as well. And I say, how about we eat the peptides? Why don't we just eat a lot of fish, chicken, beef, eggs, pork, take our digestive enzymes with aging. Do not eat them late. Like, stop eating if you're over 6 years old by around 3 o'clock, and eat plenty of this protein. Stop eating mid-afternoon use your digestive enzymes, exercise at least 3 times a week, weightlifting, do other stretching and aerobic activities with a little burst of speed walking or hit training, high intensity, a few seconds of as fast as you can, then back to a brisk walk, and then almost at a jog, about 20 seconds on the minute. Do these kind of um, lifestyle, aerobic, weightlifting, high protein, digestive enzymes, drinking enough water, taking select research nutraceuticals that have been proven to protect the DNA and to improve lifespans and reduce DNA damage. Find a doctor who's skilled or teachable in these areas. I mean, there was a day when I didn't know a lot, and I first came off of active duty, and I started working with Whitaker Wellness in Newport Beach in the 1990s, mid 1990s. And I was unsure of myself. I knew I was in the right area. I didn't know if I had the right product to recommend and so forth, but I built up slowly and steadily. So I don't begrudge any of these young doctors or old doctors who are now flipping to the correct way to practice medicine, which was always learn about slowing down aging and the terrain management rather than such invasive imaging and surgical and drugging their patients prescriptively. And then work with a doctor who will do that and follow you there. And that's what I think about peptide injections. That's the last thing I would ever consider doing. And I have a concern about the doctors who practice that. It's high dollar, it's glamorous, and they figure if they inject you, they've done their deed. Well, you know what? I don't think you're a doctor if you just inject someone. I think you're a doctor if you sit down with them and they say, "Honey, how hard is your day? How many kids do you have? Oh, they're grown. Maybe they're breaking your heart, and they dumped a grandchild on you to raise for them while they're in a rehab. Or life is hard, and it's hard to help those dear, wonderful people make it through this hard life. And there are these doctors who just want the perfect, beautiful, thin woman body or the perfect muscular guy to come in, give them a little injection, make their money. And then, boy, they're the doctor, aren't they? No, the real doctor is the one that sits down with that patient, that male or female, and says, "How are you doing? Are you working in, taking care of yourself with enough water, trying to get that sleep in? Can you work in the weightlifting time at the gym? Can you uh, eat more and more protein? Can you do these things and so forth?" That's the real doctor. So I have a bad attitude about peptide injections, I guess. Cynthia, she goes on, "Thank you. May God continue to bless you." All right. Well, help me not to get bitter in my old age. I do appreciate research, but look I've been part of this team ever since I was a young doctor working with, now we have Keytruda, which is the immunotherapy, which is designer immunoglobulins for certain antigens in cancer. We were coming up with immunotherapy back in the 90s when I was working with Brzezinski on peptide therapies, even for cancer treatment with neoplastin. So I'm not impressed with all these oncologists and these brand new ways and breakthroughs with colon cancer reversals. Hey, why don't you give credit where credit is due to these old, wonderful doctors who've been slaving through doing all this research, trying to heal the terrain and build up the walls and defense and looking at natural things like that instead of the NIH designer chemotherapies. So, yeah, I do have an attitude, so I need to be prayed for so I don't get bitter. Okay. Um, then we have Christina. Hi, Dr. Rita. What do you think about the risk of tetanus living on a farm? I heard people living with livestock are at high risk. Is the tetanus shot needed? Usually it's a spore that is in the poop that the cow or the pigs splatter onto the fences, and you accidentally scratch yourself or puncture a deep puncture wound is more implicative of a deep penetrating wound with a spore on it from the crap pooped out by the farm animal. So if you're careful and you are not stepping on nails in the farm by the fencing and wash it out, you should be fine. And the there are treatments for it. God forbid that you ever had it. You see, I have very little trust of the vaccine industry with all the corruption, and so it is with great concern that I would ever recommend any vaccine of any nature at all at this time, with so much corruption in the field and deceit. And I can't give informed consent anymore because they don't give us the information, they cover it up, and they deceive in medical school training some of the risks, quite a bit of it in even the development. Plus, they're indemnified. These vaccine producers, you can't sue for anything they may harm you with. And so they're not inclined to produce any safe materials, and they don't follow the mandated law, the 1986 Childhood Vaccine Injury Act of 1986, that demands every 2 years NIH produce safety updated reports, and they've done none, zero, none. And I've been saying this for decades, long before the COVID scare, long before our favorite little John F. Kennedy, long before, Dr. McCullough and Dr. Malone. I've been teaching this since forever. And so I'm so glad these guys finally learned. I'm so glad these guys finally are speaking the truth. But there have been those of us who have been out there all these years building this foundation to help build the network and information to get this out to you. Now, I'm grateful for what they're doing, and good on them. But I give credit to all the old time doctors teaching the terrain. So essentially, I'm not in favor of any injectables to prevent disease at this time in my life because I don't have sufficient information. I have, in all the years that I've been practicing, and I grew up on a farm, and I worked largely at Fort Knox, where there were all kinds of pigs and cattle and stuff, and fencing where the troops were, and nobody got tetanus from their scratches and so forth. So I don't endorse it. I don't have enough information to give informed consent to do it. All right, she goes on to say, Christina says, I personally don't like vax, but I am worried. Don't be worried, be informed, and use proper footwear and gloves if you're working on fencing and stuff like that. And there you have it. Jane says, I have had COVID for 5 days. I don't know if you've had COVID for 5 days. If you went and had some test that claims there was the antigen antibody or PCR testing for COVID, I don't trust the test. What should I be doing and taking to increase my very poor energy? I finished taking Paxlovid and Robitussin today and Zithromax yesterday. Well, I would get to a functional doctor who can give you ivermectin, and I would take the dose appropriate to your weight. I would do that for a week, and then I would use the dose twice a week for at least 3 or 4 weeks, a month afterwards, to have some long-term prevention. I would come in and get a high-dose vitamin C drip. I would make sure you're on vitamin D 10,000 a day with K2. I would make sure you're on a TLC multi-mineral that has enough zinc in it. I would be on a very low carb diet. I would drink plenty of water. I would get plenty of sleep and eat lots of protein to repair your body. Those are the basic steps that I would do. Constance says, my blood pressure is excellent every time I visit you. When I go to any other specialist type doctor, I have a higher BP. Is it because they blow up the band so tight it really hurts? Constance, I don't know. I don't know the quality of care, the calm. I pray to the Lord that we have a place here that emits the love of Christ in our clinic, the love of his creation, every human patient coming in here. And I pray my healthcare providers, who I know love the Lord and are trying to extend his love and respect for their bodies, and my staff. So I think that is a calm feature. I've had many patients tell me how warm and like coming home to grandma that it is coming here. And so maybe that is why you're more relaxed here. I think if you only have an isolated elevated blood pressure visiting the doctor, they call that white coat syndrome. And it's validated by if you come here and then you're normal, you know, it just goes to show. Now, I just incidentally, interestingly enough, I was listening to some dental lecturers over the weekend. And what I found is that mouthwash, all of these Listerine and mouthwashes are killing the healthy bacteria that is in our mouth that God put there. And it is being destroyed. And it gives even the tiniest amounts of bad bacteria undue favor. And they produce these endotoxins, which we swallow with our saliva and creates vasoconstriction and generates high blood pressure. So they've been doing literal studies on mouthwashes and blood pressure elevations. And they found by just stopping uh, mouthwashes, blood pressures have improved within 4 or 5 days. So if you're using mouthwash, you know, that's a very simple thing to do. Another thing is the fluoride in the toothpaste is also harmful to healthy bacteria and the good oral flora. So the toothpaste that seems to have the best data is what is called hydroxyapatite nanoparticulate. Nanoparticulate means the hydroxyapatite molecule is so small it can actually penetrate very easily into the dentin and the gums and tissues, which helps remineralize and re-enamelize your teeth, actually remineralizing them. And the xylitol is a non-sugar, caloric sugar that is associated with also very good oral health. So I think the one that I bought is Dr. Jen, Jen. If you put Dr. Jen, Jen toothpaste, I think you'll see it. She's a young dentist who came up with this formulation of the hydroxyapatite with xylitol. I bought mine that has a little elderberry in it, so I have an extra antioxidant in mine. And I think it makes a difference. I've been using it a week. Of course, I've never used mouthwashes and that kind of fluoride stuff. I've been always teaching against it. So, by the grace of God, He's been teaching me and keeping me in a healthier state all these years. But yes, for blood pressure, why don't you make sure you're not doing any of that? Okay. And then Alexander says, is there any way to protect oneself somewhat from radiation before having a CT scan? Yeah, take high dose vitamin C in the form of you could come to the office here and get a intravenous infusion of vitamin C for an hour, and then go get your scheduled CT. Another way you might do that is get the brand name is Live On, Livon. That's Dr. Thomas Levy, cardiologist and lawyer. He is a proponent for the past, and he's another one of these guys who's been around for 50 years helping move us toward building the research, the immune system research to help treat and prevent cancer. So Dr. Thomas Levy, Levy, and you can put in vitamin C intravenous and listen to him on the YouTube. But he helped support a company that came up with liposomal, and that's where they take these phospholipids right here, the bottom part and then the top part, bottom, top part. These are little phospholipids and little phospholipids hanging down, and they put that in a container, and it just makes a sphere, and then they put inside the sphere vitamin C. So it's called liposomal vitamin C. And the name of the producer that has had research on his product is called Livon. And the O is capitalized, but it's all one word, Liv, capital O-N, Livon. And Dr. Levy has endorsed that. So they've done testing. When I put an IV in your arm, and I can get, with 10, 25 grams of vitamin C in your vein, I can get you up to roughly 300 nanograms of vitamin C, ascorbic acid per deciliter. That's the level that is powerfully anti-cancer, antiviral, antibacterial, antifungal. And this liposomal vitamin C seems to be a reasonable approach called Livon, Livon. So that would be another thing you could do. Do the chelation therapy after you get the CT scan with the dye. That way I can pull out the gadolinium heavy metal toxin that they injected in you and get you to pee it out. So you can do EDTA chelation after it, the same day, you can do it later or the following day. So that's what I would recommend, Alexander. Rana says, goodness blessings. Well, hi, Rana, how are you? Good to see you and your family. Tetanus immune globulin is what can be given if exposed to tetanus, not the vaccine. Yes. What are your thoughts? Yeah, you can be on tetanus immune globulin. That is the antibody already. That was like the monotherapy that was given, monoclonal antibodies that were given for COVID that they shut down so that they could pimp their resveratrol. No, not resveratrol. What was the name of it? The name of that drug they were treating people with in the hospital that created kidney and liver organ shutdown. They used it in Africa for Ebola. Resveratrol. I forget the name. Okay, but anyway, yeah, this immunoglobulins is something, yes, you could use also. But, the experience of that, I don't have any. In all the farming, military, mud and junk in the fields and the farm areas of Fort Knox, where I did a lot of my training, we never saw that. Remdesivir. Yes. Thank you, Rana. Thank you, you guys. See, you help educate me. Remdesivir. Yeah. There you go. All right. So let's go to some of these rest of these questions here. Let's see. We got to now, Christine. May I get your opinion on hormone replacement therapy for persons with cardiac conditions, heart failure, low blood pressure, and an extended QT interval? That on the blimp of the heartbeat, where you go beep and it has the blimp. There's spaces between all of these things, and they're measured. A QT interval is one of those intervals. And if you get some injury to your heart, that interval can go long. Now, I had a pan-myocarditis when I was 16 years old, and I had, ever since then, first degree heart block, prolonged QT interval. I've been on hormone replacement therapy, and of course I had hormones as a teenager throughout all my life and my children. But yeah, I had heart failure for a little while there, tachycardia, low pressure, all those things. Hormones are not a risk. So let's see what is Christine saying. Cardiologists and mainstream primary care physicians argue against it. I'd like to be able to rebut their arguments. I don't know of any peer-reviewed material that says natural hormone replacement therapy is anything but a benefit to cardiac performance. In fact, tell your doctor, we'll look at women have very, very low heart disease up until they hit menopause, and then they rapidly develop a risk ratio like for men after menopause without their hormones. So now you're going to tell me hormones are now a risk for heart disease, heart failure? No, it doesn't make sense. Things should make sense for the most part, people. And we know, in fact, that hormones are cardioprotective, especially testosterone. And women can be given testosterone, especially if you have heart failure. In fact, back in the 1920s, 30s, 40s, with the very first onset of heart attacks and heart failure, the only thing they had was testosterone to help people with, and nitroglycerin. So give me a break. We have old-time wonderful things available. next time you see your doctor, you say, you show me the peer-reviewed reference that you're referring to in trying to turn me away from using natural hormone replacement therapy. Because my own doctor, me, uh, Rita Ellithorpe, has had heart failure, pan myocarditis, meaning every layer of my heart, the endothelium, the myocardium muscle, and the pericardium all became inflamed from a horrific tonsillitis. That was I don't know, I was 16. And then I just went into irregular heartbeats, hospitalized 4 months. I was in the hospital. And then what did my dad do? My dad got me high dose vitamin C, EDTA chelation therapy, and all the stuff that medicine couldn't do. Of course, this was in the 1960s when I was a teenager. Um, it was all repaired with natural therapies, working on my terrain, improving my everything about myself. The doctor even took me to church. Can you believe that? When I was in the hospital, Dr. Ray Evers, a famous, wonderful doctor that was hounded out of the United States, terrible treatment for this wonderful man. He's the doctor that we can claim off-label use of medications because he fought the war for us doctors in Congress. If we're educated enough to prescribe a medicine, we're smart enough to know if a medicine may have value in another applied area under our supervision. That's called off-label use. Dr. Ray Evers, my wonderful father, took me there when I had all this heart disease as a teenager, hospitalized 4 months in the cardiac care unit. And that was at Elk Grove Village, Alexian Brothers Hospital. But when he got me out, he took me to Dr. Ray Evers in Andalusia, Alabama. And there I was getting better, and he took me to church with him on Sunday mornings. I love medicine when I see these wonderful men of God and healthcare serve us. Bless his heart. I hope to see him in heaven. I'm sure I will. And tell him a sincere thank you now that I'm a wiser and older. And when I decided to go to medicine, I was so afraid. I was so afraid I couldn't do it. I couldn't do it. And my husband, my dear, wonderful husband, drove me down from Fort Knox, where he was on active duty during the Vietnam time. He drove me down to see Dr. Ray Evers, and Dr. Ray Evers said, Rita, you can do it. We need good, godly doctors, So he knew the Holy Spirit was going to have to do all the work, because I was just a little girl who married my husband at 17 and just wasn't getting pregnant for some reason. I don't know. And I just love science like my dad. And he let it all happen. So praise the Lord. God is so wonderful. Give it to God, people. All right. Next question. Oh, that's a sweet thing, Rana. You said, I don't want to speak it out. It's so sweet that you said that. You, you patients, you people, you are created by God. And every person who is a doctor, I think you should have every right to ask them what is their worldview. If that doctor is too afraid to say well, I'm an atheist and I defend it with this and this and this, or I'm this religion, or I'm a that religion. If they can't say what they are and defend it, I'd be afraid of how they would judge managing my body. Um, I would want to know how valuable they think my body is and be accountable to God for how they take care of it. So you ask your doctors, even your plumber. I had what was he? He was in there for, it was the internet. They're putting in that fiber internet lines. And two men came to my home and said, well, it's laying down the fiber internet. It's great. Everybody wants it. Do you want it? And I said, I have to talk to my husband. He's my manager, and my son, and they run these things, and I honor their leadership and rule that God has established. Well, these two men, their jaw dropped, and they said, you really honor your husband and your son? And I said, yeah. And so they were just blown away when I said, I don't want to even work with anyone that'll be in my house, touching things I have, seeing what I have, unless they have the worldview of a Christian, So they were blown away. So I ask everyone, if they're going to work for me, I want to know their worldview, whether they're going to sham me out of something or whether they'll be standing before God and say, I was honorable in all my dealings with all my clients. All right, too much talk. Now, the next one. The next one is Mano says, IP6, what is it good for? IP6, I think Mano is referring to inositol hexaphosphate. That's 6 phosphate groups on an inositol molecule. And it's like a chelating agent, and it can take on 6 phosphates. And it is really phytic acid. And phytic acid, PHYTSA, phytic acid, is very valuable in anti-aging, digestion, immune health. It's a powerful antioxidant. It is used in chelation, in cancer therapies. It helps prevent calcium excess and iron excess in the human body. So it does many wonderful things. Julie said, my friend sometimes struggles with erectile dysfunction. We realize these drugs aren't good for the body. However, if he has to choose the lesser evil in order to assist, which would you say is better choice for the least amount of side effects or long-term issues it can cause, Cialis or Viagra? Cialis is long-term. You can take like a 5 milligram and it'll last, 24 to 36 hours. Viagra is more short-term, and their onset of action is similar for both, within 30 minutes to 60 minutes. But Viagra doesn't last as long. I think it's more like 12, at most 24 hours. So I don't know of any long-term effects that I would be so worried about. At least I haven't come across them. And so it depends on if you only want to use this episodically, short term, then I would use the Viagra because same onset, same action. It only is effective for a shorter amount of time, whereas Cialis lasts longer. So that would be the only advice I have there. George says, hi, Dr. E. I was wondering, Juice Plus is not organic. That's not true. It's beyond organic. There's such a thing as that. Isn't there a better alternative with all the pesticides and chemicals? Why take anything conventional these days? Also, it is much more beneficial to eat fruit with seeds than seedless. Is this why many doctors are not big fans of fruit anymore? George, I'm going to tell you, just recently, Juice Plus, with its about 30 years of science-based research published in peer-reviewed articles of noble stature, have over and over again set the standard for all nutraceuticals to come up to. It was Juice Plus and its science and its long-term benefits that had been borne out over these 30 years with people using it. Juice Plus has had DNA studies to prove that it reduces DNA damage in better than 1,600 gene areas of research over and over again. Not one study, several have endorsed and replicated that. Number 2, it's immune boosting, white blood cell immune lymphocyte count action, several studies on that. The children's health studies have shown less days missed of school, less failure in grades. In other words, better academic and athletic activities, less sick days. What else has it shown? It has had cardiovascular homocysteine beneficial aspects. In other words, there are so many things about it. And then the production of Juice Plus is beyond organic, meaning the small farms where they grow this, they don't even use pesticide, herbicide. They'll use natural flowers to repel insects because certain flowers repel certain insects and pesticides. And then when they get fully ripe, they're harvested and flash frozen right on the small farm right there. And that is then sampled for any cross contamination from a neighboring airdrop of pesticide, herbicide of maybe another farm, if there's anything there on the spectrophoramorphic of the flash frozen sampling, they get rid of it. They sample the water at the sites. They're doing water to make sure the irrigation doesn't have it in it. Then when they get to the plant and they do their first desiccation, dehydration of it, they then sample the dust remains. And then after they encapsulate it, they do another assay for pesticide, herbicide. In other words, George, this is beyond organic. Now, also, I want to tell you, just recently, the National Institutes of Health, even though I've greatly lost my respect for them in almost all published articles of science, John Ioannidis, which is Stanford, John Ioannidis is a MD epidemiologist researcher who studies research, meaning how good, how accurate is our format for doing research. And he published in 2005 an article entitled Nearly All Published Research is False. Nearly all published research is false. And he defended it eloquently in that publication in 2005. He just redid the article and did more on it after the aftermath of this pandemic hoax. And he just published another article on it, and the title is similar. It says, why most research is still false. So he added one word, the word still. Why most research is still false. And so that is published just in 2024, I think a year ago, February. And I just listened to a lecture on him, and he's teaching researchers and MD, PhD candidates about the intent of what research is supposed to be for humanity, not for some money-making big bill guy buying the science and outcome he wants. It's just tragic that we have this now. So yes, I'm quoting the research on Juice Plus, but at least Juice Plus is the most nutraceutically, I think it has 42, maybe 44 peer-reviewed articles, including me. I published on it as well. And that set the standard for every other nutraceutical, and I think opened up the eyes to all these doctors who are now what I call Johnny-come-latelys to functional medicine, who are now realizing that this is where the real action and healing is, and they're racing to learn all these nutraceutical things. Are they sincere, or is it just to be posh and make money? I don't know. I hope it's for good reasons. But Juice Plus is fantastic. The NIH selected the Vineyard blend, which is the berry concentrate. It's just taking the fruits, vegetables, or berries. They chose the berries. They freeze it, then they dehydrate it, and they do nothing to it. They don't treat it other than to concentrate it into a powder and put it in a capsule. So I think there's 8 or 9 different berries in the Vineyard blend. I am so impressed with everyone who's on Juice Plus all these decades. I've been on it now with my family about 30 years. I cannot believe the degree of disease that we have missed and the slowing of our aging. So yes, Juice Plus is worth it. Brian said, good evening, Dr. E. Would you recommend Prevnar 20 vaccine? That's a streptococcal vaccination for about 20 different, at least, strains of infective strep pneumococcal. And I don't think it's needed. I don't trust the company. It's made, I think, by Pfizer on top of all of that, who has led us astray. How dare I would recommend it? I can't recommend it. I don't have informed consent. They've not been open, and they've tried to withhold data. We had to do freedom of information work to extract data out of them. And thank God the courts sided with us. No, I wouldn't recommend it. Work on your terrain. Work on being healthy. Mary, thank you for this opportunity to find valuable answers in this way. I wondered if you may recommend something natural in liquid form to promote bowel movements long-term in someone on a pure liquid diet due to health conditions. The doctor has tried senna and lactulose and now has reverted to the gallon of liquid that is used to prep for colonoscopy. Well, Mary, I don't know who you are or what your problem is. It sounds like you've had uh, if you have a liquid diet, you're probably on had a hemicolectomy or a colectomy from chronic Crohn's or inflammatory bowel disease. So you need especially a functional doctor to look at your nutrient status. But what I would use is, remember we were talking about the powders of this phospholipid to help the lining of the gut. Remember, you have to repair all these injuries right here. You have to repair that. And the way we do that is with phospholipid powders. And so you can mix that in with something like aloe vera. I think phospholipid powder, SBI Protect powder, mixed in warm water with some aloe vera, if you took that twice a day, that would be very helpful. But get a good functional doctor to help you with that. Cynthia says, what causes new moles to appear? Is it toxins? Why does the skin become crepey? We're losing our collagen and elastin and our ability to repair all those injured cells. And as our skin thins, it doesn't have enough elastin and collagen to hold it up anymore. So my neck doesn't get held up as well. And the skin gets thin that way. Plus, as the skin thins, you start seeing spider veins and veins more. You bruise more easily because you don't have that protective layer as thick anymore. And then the blood vessels, the little hemangioma red spots show up. And some of this is damaged, and you have to have it checked to make sure they aren't skin cancers with your dermatologist. And then the Diane said, I am a 71-year-old female patient of TLC. I follow the general diet, intermittent fasting, supplement protocol you recommend. I take Juice Plus, Vascuzyme, hormone replacement, exercise. My weight is good. I was recently diagnosed with atrial fibrillation, the type that causes strokes. Well, any AFib can create irregular blood pooling in your heart, and these little blood pooling areas from incomplete contraction of the atria can make the blood sticky and then make a stroke. The integrative cardiologist said I must take Eliquis 2 times a day and Metoprolol 2.5 once a day. Thoughts? I think that's fine. Work with your us. Come here because remember, drinking water is an anticoagulant. Taking systemic enzymes is an anticoagulant. Eating a low carb diet is an anticoagulant. Getting a good night's sleep is an anticoagulant. Taking a walk and exercising is an anticoagulant. So when you do all those things with natural hormones and plenty of water, I've just never seen anyone clot off of this. So maybe after being on it 6 months or so, you can convince your doctor that you are going to be healthy and do fine. I have never ever in my 44 years seen a blood clot on people who take their enzymes, drink their water, get a good night's sleep, exercise, eat a low carb diet, and so forth. So there you go. Simon says, hi, Dr. E. Thank you for taking my question. I read that iodine is not good for those with hyperthyroidism. Is that true? Well, every case, Simone, is a special case. But in general, as you have a attack on your thyroid, this autoimmune destruction usually releases from the damaged cell more thyroid than would be in general needed. And you get hyperthyroid from it. But then as the damage diminishes or comes down to a low smolder, then you have loss of iodine. And most of us are iodine deficient anyway, at least 96% of all Americans. So I'm not going to say that using iodine is a danger at all. There is a book out there by Dr. David Brownstein, Brownsteine, Brownstein, and he came up with iodoral 12.5 milligram tablets, and he addresses this very nicely. I would get that book, Iodine, by Dr. David Brownstein, and read that because I don't think it's dangerous in the hands of a doctor who knows what they're doing. Susie says, I'm on a carnivore diet. I've heard some YouTube stating it can cause damage to your kidneys or even failure. Well, I have never seen that. I have never seen anyone in my entire medical practice eat enough protein to harm their kidneys. So, and I have people that have, stage 2, 3, and 4 kidney failure, managed also with nephrologists. So I would have to say, you show me the peer-reviewed articles that prove that I can actually see usually a healing take place. So Susie, I just don't see that. Josie said, have you heard of parasites in the pancreas causing type 1 and type 2 diabetes? If so, how do we check for this and cure it? This is marketing. I have never seen this. And I am not going to say we don't have a world of flora on our skin, in our gut going on, but there is no parasite. You're going to fall prey to artificial intelligence, fake doctors mouthing things that talk this way, even people that you might respect. This is foolishness. I have never seen it. Believe me, it would be nice to see if this was treatable in this fashion, but no, I've never seen it. I think it's foolishness. I think they're just trying to market something. And then finally, since a severe respiratory illness in 2021, I have had daily worsening of shortness of breath and can barely walk a few feet. Heart function and oxygen levels are normal and tests are clear. A large hernia was found near the right lung, but no cause was confirmed. I was healthy and active before, now I'm 86. Any insight is appreciated. As we age, our mitochondria, our engines in all of our cells and our muscle cells are injured significantly. What I would do is find a good functional doctor who would help you with maybe doing some long COVID protocol with ivermectin, give you some high dose vitamin C drips, look at the protein content in your diet, get you working for building muscle strength twice a week with physical therapy, and give you some powerful nutrients that will help mitochondrial function, and then we'll go from there. So that's what I would say. Try and find a good functional doctor that will do that. Now I'm 7 minutes over, but I got through all the questions. Yay! And so I'll see you all next week at Tuesday at 6 o'clock to 7. If this has been of value to you, please like, please subscribe, and please share this with your family or friends. And we'll see you next week. God bless you all. Thank you.